Hello everyone, today I'm going to be showing you how to measure an oral, axillary and temporal temperature.
Temperature is defined as the degree or intensity of heat present in a substance or object, especially as expressed according to a comparative scale and shown by a thermometer or perceived by touch. We should always remember that the adult body temperature normal range is from 97 to 99 degrees Fahrenheit, which is equivalent to 36.1 to 37.2 degrees Celsius, and the children body temperature is from 97.4 to 100 degrees Fahrenheit, which is equivalent to 36.33 to 37.78 degrees Celsius. Any temperature above 100.4 degrees Fahrenheit, which is equivalent to 38 degrees Celsius, is considered to be a fever in both adults and children. A thermometer is the instrument used to measure the temperature of a body or object. There are many different types of thermometers. We have the glass or the analog thermometer, which is usually filled with liquid. Formerly, mercury was used to fill the thermometers, but now other metals are used. Digital probe thermometers, infrared thermometers, and more. Glass thermometers are rarely used in a healthcare setting due to the risk of breakage, but they are still relatively popular for home use. There are several means of measuring body temperature. They include the oral method, axillary method, temporal method, renal method, and the tympanic method. However, we're going to be discussing only three methods, which are the oral, axillary, and temporal method. The first method we're going to be discussing is the oral method. The oral method involves the measurement of the body temperature using the mouth. In order to measure the temperature of a body orally, you need to follow the following steps. The first step is to observe proper hand hygiene and put on your gloves. Clean your thermometer properly. Add a thermometer probe cover for added protection. Ensure that the patient hasn't consumed food or beverages, and if they have, wait for about 15 minutes before you take the temperature, as this can distort the temperature. Have your parent raise it to our mouth and place the thermometer under the tongue for a few minutes. When you are done, discard the thermometer probe cover, take off your gloves, perform hand hygiene, document the temperature and the route used. Now, let us take a look at a demonstration on how this is done. The first step is to wash your hands properly and carefully with soap and clean water. This will help to limit the spread of contamination that might be gotten from fluid that might come out from your patient's mouth. Then, you should complete the hand hygiene process by putting on sterilized gloves. It is also important for you to clean the thermometer with an alcohol pad. In case you're using an analog thermometer, ensure that the reading starts from the base level. If it doesn't, you are to shake the thermometer lightly before taking the temperature of the patient. Ask the patient to raise her head and then put the thermometer under the tongue for a few minutes, and then after that, check the reading and document it properly. Now we're going to be looking at how to measure the temporal temperature. The temporal temperature refers to the measurements through the temporal artery on the forehead. In order to do this, you need to observe proper hand hygiene and to put on your gloves. Clean your thermometer properly. Add a thermometer probe cover for added protection. Place the sensor head at the center of the forehead. Slowly slide the thermometer across the forehead towards the top of the ear. Keep it in contact with the skin. Stop when you reach the hairline. Read the temperature on the display screen. Please note that the newer models of forehead thermometers, especially the ones developed for the current COVID-19 pandemic, do not require skin contact before temperature can be taken. Check the box and read for the instructions and the directions on how to measure with it. After observing proper hand hygiene, swipe the thermometer across the forehead of your patient and check the reading on the thermometer and ensure you document it properly. Now we're going to be taking a look at how to measure the axillary temperature. The axillary temperature is the temperature measurement using the armpit. Put the tip of the thermometer directly into the armpit and ensure the armpit is dry. Close the armpit by holding the elbow against the chest. Do this until it beeps for about 10 seconds. The tip of the thermometer must stay covered by the skin. All of this must be done after you have observed proper hand hygiene. Don't forget to ensure that the reading on your analog thermometer is in the right place. When you are sure that this is in place the thermometer directly on the skin of your patient. Do not place it on a clothing. Ensure it touches the skin of your patient. Then close the armpits of the patient and wait for a few minutes. After waiting for a few minutes, check the temperature and ensure that you document the readings with the appropriate route in the temperature chart.
Temperature measurement is the first step in determining if a patient has fever. Healthcare facilities and public centers should ensure that they take the temperature of whoever might be coming in order to detect illnesses such as the current coronavirus.